All right, my first time going live. Looks like there's a couple people maybe watching or on. Good. Feel free if you're available to ask questions or maybe type in the chat. Can untreated psychosis lead to dementia? So we do find that people with psychosis, for example, in diseases like schizophrenia, they can get earlier dementia than the general population. And so, yes, untreated psychosis, even when psychosis is treated, it could lead to dementia. And when people are older and they are starting to develop symptoms of dementia, sometimes it can start or present itself as psychosis. For example, if someone's in maybe 70s, 80s and start getting psychosis for the first time, that could be a sign that it's dementia related. Yeah, very nice. You're welcome. Nice question there. Any other questions? Or I'll just hang out in case someone comes on later and Okay. Hi there. Anyone has questions? Is ketamine therapy helpful? Um, yeah, they do find that for depression, ketamine can be helpful, can help with also suicidal thoughts, so like severe depression. Um, it's done only in certain settings, like certain clinics will offer it because there can be some side effects with it that need to be monitored sort of in like a clinic or a nursing setting. Uh, but it can be helpful, and there are a few clinics that do offer it um, in the Sacramento area for depression. Hopefully that answered your question. I'll hang around a little bit longer if there's any more questions or concerns. Would an SSRI interfere with ketamine therapy? That's a good question. I I think it might depend on what type of ketamine therapy is involved. Um, there is, for example, a nasal form of uh, ketamine therapy, which actually it's preferred to be on an antidepressant like an SSRI because it's just more of an adjunctive treatment. And the patients that I'm familiar with that have received ketamine therapy are also on antidepressants, such as SSRIs. So um, there, there may be some minor interactions, but I think usually the ketamine therapy is done while someone is also on SSRIs or some sort of antidepressant. So, uh, well, thank you, Bob, for the input, and those are good questions. So glad it's been helpful. Um, Anybody else have any topics they want to bring up or questions? Well, just I'll hang out a bit longer in case something comes up. Okay. Probably go till 15 after, unless anyone has questions they want to propose or something comes in. Yeah, so I'm a psychiatrist and here just doing questions and answers. And if please feel free to type any questions in the chat if you have any other. Um, had a couple of good questions already, some challenging ones too. Um, so okay. We'll just be on for a few more minutes, unless there's any questions anybody has. All right, I guess it's almost 15 after. Had some pretty good questions thus far. Thanks for your guys' participation, and maybe we'll do this again like down the road.